Welcome to the HITea with Grace, where we spill the tea on HIT. Today, I'm honored to welcome to the pod friend and healthcare AI's fiery big sister, Dr. Heather Bassett, Chief Medical Officer at Xsolis. Thanks for joining me today, Dr. Bassett. Tell me, Dr. Bassett, tell us all about your career journey that brought you to your role today.
Yeah, I'm definitely a math and science nerd at heart. When I went to undergrad, I went to Carnegie Mellon. I went there to do both biology and computer science. This was back in the late 80s, early 90s. I was really excited to kind of be part of that early journey, but halfway through, I decided I didn't want to be in front of a computer all day. So I dropped the computer science, although I'm pretty much in front of a computer all day these days. But I went on to do research in basic science around DNA repair. I definitely have a high risk of having skin cancer. So I really enjoyed that I was able to put some work in that area around preventing skin cancer and understanding it better. But I realized I couldn't go that much further in my career with just a bachelor's. And I really had a strong interest in medicine. So I decided to apply to med school, ended up getting into a University of Texas medical branch in Galveston, which is also where I met my husband. And did that for 4 years and moved on to do my residency in internal medicine at Vanderbilt, which is what brought me to Nashville. I've been in Nashville 20 years this month, which I actually saw some new residents recently. They started yesterday, actually, and I saw some new residents. So it kind of brought that all back of when I was kind of that wide-eyed resident, not really sure what I was getting myself into, but ended up getting board certified in internal medicine and started working as a hospitalist. I really enjoyed inpatient medicine. I did that for about 7 or 8 years. And then randomly met the co-founder of Xsolis at a wedding. He asked me a bunch of questions. I'll be honest, I didn't really understand a lot of what he was speaking about, but I recognized it was a big opportunity and kind of offered me things that I thought I wanted to do, but really hadn't been presented that chance. And so I said yes. It's one of the best decisions I think I've ever made. I started to back away from clinical practice. Started with a company in 2013 when we were literally drawing ideas on a whiteboard. And now we are 13 years old. We have hospitals across the US that we bring in AI to help our end users and ultimately at the end of the day, help hospitals get paid for all the great work they do so they can support and take care of the patients.
Wow, what an amazing journey. And to just think you started off as this computer nerd and then turned into a physician, and now you are both. You are a healthcare informaticist, and it's pretty fantastic that you can be in both, really improving the system for all. So tell us more about Xsolis. Like, what does Xsolis do, and what role do you play in the organization?
Yeah, so I'm the chief medical officer, and I've worn a lot of hats over the years. I do spend a lot of time with sales on the road, which allows me to, I've met some fantastic people at the different hospitals that we work with, but I also oversee our AI team. In this day and age, I'm learning something new every day and ways that we can help our clients and health systems. But at Xsolis, our mission is getting rid of friction within healthcare. And as you can imagine, there's a lot of friction. A lot of that is around administrative waste. There's trillions of dollars of waste out there. And that money could be repurposed to have better care and outcomes for our patients and then better quality of life for clinicians. We're really trying to find opportunities to apply AI to get rid of manual processes, primarily in the utilization review space. We also are one of the few companies that are able to sit between payers and providers, which historically there has been a lot of friction between the two, but we're able to bring the two parties together, create very transparent outcomes through AI that allow processes to be automated.
So inspiring and so interesting that you are sitting in this unique role between payers and providers and using AI to really make a big impact. As you are a leader in healthcare AI and in this space and seeing how many different ways AI is being used, where is AI most positively impacting healthcare? And please share a few examples of that. What's actually happening with AI and where is it making the most impact?
Yeah, and it's funny. I think people think that it just kind of popped out of the woodwork in the last 2 years with ChatGPT and generative AI. But AI has actually been working in the background within healthcare for many years. One area is in imaging. So if you think about radiology, and I think as women, we're all pretty passionate about improving outcomes with breast cancer and early detection because we've been personally impacted or a close family member or friend has been impacted. And so AI has been really positively impacting that case. In Sweden, they actually require two radiologists to read a mammogram in order to minimize the chances of something slipping through the cracks. They did a study, it was in Lancet Oncology. They looked at 80,000 women. They had the two radiologists read in about half of it, and then the other half was radiology plus AI. In that group, they had a 4% higher cancer detection rate.
Wow.
Which is pretty impressive. It didn't increase false positives because we don't want to stress women out having to go through all these tests and it end up being a negative. It's cost effective by doing it that way and then more efficient. And so that was a pretty cool outcome there. And we're just seeing more and more in imaging. Ambient AI is another really big one right now. I mentioned burnout. Physicians are burnt out. We're seeing them leave the workforce, which is not a good thing. A lot of them have to do work in the evenings at home. We call it pajama time, kind of catching up on charting. So ambient AI has really helped in that space. And even that kind of ambient content is now bleeding into areas around kind of that diagnostic space. There was another recent study out of Nature. So if you think about like ChatGPT or large language models, they love to challenge them and see how good they are in healthcare by basically having them take tests. Like I have to take tests to maintain my board status and all of that. And it's like very controlled statement. And then you have like 4 possible answers. Well, that's not how patients present. That's not realistic. Basically, the AI is good at taking a test. There's this system called Amy that was able to, you talk with a patient and they give you information and then you order some tests and you try to figure out in that real world setting, not just a test taking setting, it was actually able to outperform the primary care physician in diagnostic accuracy.
Wow.
So again, it's more about being that kind of listening in the background and helping and augmenting. So I'm excited about what is happening and what is happening in the near future, not like 50 years down the road kind of thing, but in the near future.
So cool to think about, and that it's already happening right now. What areas of healthcare are primed to benefit the most from more AI innovation in the next 5 years? And why do you think that?
Yeah, and I just kind of, what I just mentioned was more clinical facing, but I really think where the biggest input, and we've even seen this in the past couple of years, is around the administrative portion. Because if you think about AI, there are definitely risks associated with AI, but a ton of positives. If you think about low risk areas, kind of that low hanging fruit, it's tackling administrative waste. That's something that we do as a company and been very successful in providing a positive return on investment for our clients. We're seeing, again, with ChatGPT coming out on the field in generative AI and its ability to summarize clinical information, that's providing a lot of lift in kind of administrative tasks. We're also starting to see AI agents or agentic AI where they're able to do tasks autonomously in the background. It's usually those tasks that you don't do that it's able to take care of and then allow the user to work, we use the phrase top of your license quite a bit. So get rid of all those annoying tasks and do more meaningful tasks. I think that's really where we're going to see a lot of movement in the next 5 years.
And what concerns about AI in healthcare keep you up at night when you're thinking about the big AI word and how it's being used? What bothers you or really concerns you?
Yeah. And I'll keep it mostly in the healthcare space. AI can be used for good and it can be used for bad. And I do think we like its ability to mimic, like take my voice and use it in a nefarious way. I think we're going to have to be very careful for that and with elections and all of that stuff. But if you think about it in healthcare, I think I went to a conference once, and this statement really stood out to me. We talk about taking off all of these kind of things that drive you bonkers, these repetitive tasks, and kind of allowing you to work at the top of your license. And this speaker was talking about radiologists and the ability for AI to read chest x-rays. And it's like, well, the radiologist no longer has to read all the normal chest x-rays. They just have to read the difficult chest x-rays. So if you think of that in other scenarios, whether you're working in coding or you're working as a physician, if all kind of that easy stuff is taken off, what's left is that high cognitive burden where you have to be kind of like thinking about complex problems constantly versus like I deal with a complex problem, then I get some easy stuff, my brain gets to rest, and then I kind of come back. But so I do worry, are we going to actually increase cognitive burden and that have some not great outcomes, particularly from a mental health standpoint? So that's something I think just keeping that in the back of the mind of how we roll out AI and how we incorporate it into our workflow, because we really do have to think about the end user and the impact on that.
I've heard a lot too about biases with AI in healthcare. Is that still a concern we need to have, or is the industry really addressing that now? Are they kind of aware and really keeping an eye on it?
The shorter answer is yes, biases exist, and we have to be very careful not to propagate them. When you're training these AI models, creating agents, usually they're looking at the data that exists and you're pulling that data, and a lot of it inherently has bias in it. I think the bigger thing that health leaders have to be aware of, which helps address issues like bias, is that you really need to be part of the conversation, but be really aware of responsible AI. AI is not without risks. It's not 100% accurate. Granted, people aren't 100% accurate either, but it's not 100% accurate. Large language models can hallucinate. So we have to make sure that we don't limit innovation, but that we roll it out in a very responsible way. And I think there are now multiple organizations that are really stepping up. We joined HITea, the Coalition for Health AI, which represents a large number of healthcare systems, vendors, insurance companies, and they're coming together to put the framework in place around AI governance, regulations that will help address things like bias and making sure there's transparency, not risk of healthcare data leakage. I'm excited to be part of that conversation. I'm always a fan of being proactive versus reactionary. I encourage all healthcare leaders to be part of that conversation so you have a voice in what's happening in the future.
What I love about HITea, the Coalition for AI, is that they're including so many different stakeholders. They're including clinicians like yourself, healthcare technologists. They're including nurses. They're also including patients and caregivers and figuring out what does patient access mean to them? What does AI mean to them? What matters to them? And I appreciate that so much. Then also organizations like Direct Trust and Dime are creating certifications and validation for AI and healthcare technologies in the space. And that's inspiring as well to me because it's just like, we're all in this together. How important is collaboration in healthcare when it comes to building up AI as a system?
Oh, it's huge. If we think back to when the electronic medical records first appeared, I think part of it is we as physicians didn't really see it coming. We weren't part of that collaboration. So the early EMRs, they're better now, but they were not designed with the clinician in mind. That created a tremendous amount of frustration and actually increased work instead of making it more efficient. And so really is important to create a collaborative group when you're rolling these things out. And you want to move it further upstream on the build, because you can build the greatest AI model since sliced bread, but if you're not actually solving a problem, then why are you building it? But if you don't include the clinician and understand their workflow and how to incorporate it in a meaningful way, you're not going to have a successful outcome. What is nice is there are a lot of clinicians that are raising their hand of, include me, like, please call me. I will help you be that voice, be that collaborative piece so that we all win at the end of the day. And I do think, I loved how you mentioned the patient as well earlier, because I do think it's easy to kind of get caught up in the four walls of the hospital or whatever area you're working in. But, at the end of the day, the goal is to improve patient outcomes and for the patient to have a positive experience. And part of with chatbots and other things, the patient is interacting with AI. So I completely agree with you that it's important that they are considered in the conversation and able to give input. And that will actually help with the trust factor as well, versus people being skeptical of AI and what it's going to do.
Absolutely. As we're thinking to the future of AI, I would love for you to kind of paint a picture of what you hope for the US healthcare system to be as we implement AI in care and administration and even outreach and population health. Like, what do you see to be the future of healthcare with AI at the center?
Yeah, I think one thing that I really hope we're able to do, yes, there's preventative medicine, but we spend a tremendous amount of time providing sick care. I really hope we're able to move into more of that health optimization and moving more and more things upstream instead of someone showing up in your office and you're kind of at a place where all you can do is treat, prevent. I think between technology and layering in AI that we're going to have the tools to do that, whether it's I think there's only so many wearables you can fit on yourself, but we're going to start to see implantables, sensors in the home. Tech is going to get much smaller, having more opportunities to get information to a medical professional sooner, I think is really going to help. I think more and more things are going to happen in the home versus going to your doctor's office or even the hospital. Another big thing that I think is going to move the needle is deeply personalized medicine. Like right now, if you come in and you're diagnosed with hypertension, there's first-line medications that we typically provide at a standard dose. With our ability to prick your finger or do a mouse swab, send it in and have your entire genome, that provides a tremendous amount of information on any diseases you have a higher likelihood of having, so address those as early as possible. We have gene editing cell therapies now, so if there is something that needs to be fixed, like literally can fix it at the DNA level, I think we're going to be able to do more and more of that. I think more targeted drug delivery, whether it's at a very localized area, again, through maybe an implanted source, but very specific dosing and combination of medications.
Wow. So cool to think about, right? I mean, could we have ever imagined that 10 years ago, even
No.
5 years ago? Like we're really on the cusp of something exciting and just care, research, and beyond being truly improved by AI. So Dr. Heather Bassett has just launched a podcast, AI Amplified on Healthcare Now Radio. So tell me, Dr. Bassett, what inspired you to start this podcast and why are AI conversations like the ones you're going to be having so important?
Yeah, I'm pretty excited about this. Just recorded the first episode last week, so it should be coming out soon. Actually recorded it with a friend of mine. She and I went to med school together, Dr. Stephanie Lahr, and I don't think either of us expected to be executives in the AI healthcare space at all. It was fun kind of just speaking about our journey and why we feel like we're making a difference in a slightly different way than probably planned on doing it. So that was a lot of fun to have that conversations. But I think there's just the ability to meet so many different individuals. I love when I go to conferences, even if I'm just randomly sitting next to somebody at lunch, I just really enjoy hearing a different viewpoint. I really want to have it be a very well-rounded conversation, not just the rose-colored glasses around AI, but the wins where there's been struggles. And so I'm pretty excited to have those conversations. We're rounding up a pretty cool list of folks that we'll be speaking with.
That's fantastic. And to be really telling the true story about what's actually happening with AI, it seems like there's so many stories out there. And it's like, is this really happening now? Is it not? Like, what are the challenges? People are almost too scared to talk about the challenges because they don't want to deter people from using AI. And so I think having that full conversation is going to be critical. So can't wait to see where that podcast goes. Now, my listeners love to learn about what's going on in the industry, but they also love to learn about women leaders and their journey into becoming who they are. So tell us, what are some things that you do in your personal life that just help you work your best and make a difference? Do you have any habits that you feel really support you in the job that you do each day?
Yeah, I think something that I've been much more intentional about over the last couple of years is that work-life balance. I think that you have to be able to kind of turn your brain off a little bit and spend time with friends and family and do things that you enjoy in order to be more productive at work. So I do try to be more intentional about that. I'm also a big believer in exercise, and that's always been my stress reliever. I have to admit, I'm not as fond of this aging thing because it has changed some of the things I've had to do over the years.
What?
So I have kind of changed that, but I've gotten more into group activities where I can still break away and do solo stuff because I like to have me time where I can just really, I'll get on a bike and bike. We've got some really pretty areas to bike here in Nashville, so I can bike for like 3 hours and let my brain unwind itself. And so I really value having, it doesn't have to be exercise. I will say there are positive health benefits to that, but I do think it is important to have some form of outlet, and then just having a good friend base and family base, surround yourself with that is also, I think, part of what helps me become more successful.
Absolutely. I love that. And just the story of you interviewing Dr. Stephanie Lahr and your experience in med school and beyond and going into healthcare technology together. And it is so important to have great friendships that you just do life with and you encourage each other and you can be honest with each other. Something I love that about you too is you talk about the joy of medicine. What do you think is important? And why is returning the joy back to medicine so important, like in this day and age?
Most people, and when they go to, and I'll take it from the physician standpoint, most people, when they go into medical school, part of it is like you find that very interesting from a science standpoint and understanding how the human body works and disease pathways. But the other part of it, you go because it's a very unique space to be in. People literally put their life in your hands. The ability to kind of, whether it's helping them get better or even helping them at the end of their life, which is probably even more important. I think the ability to help people is a big part of the reason you go into medical school or become a physician. It is a mentally taxing space to be in. Can be very stressful times. And there's a heavy lift in the hospital, things you have to do. Like you have to fill all this paperwork out and you have to order all this stuff. And I think a lot of physicians feel like they're pulled further and further away from the patient. So maybe you used to spend 80% of your time patient facing and 20% of the time in front of the computer. Now it's the flip. And I think that's why people are losing the joy of medicine. That's not really what you signed up for. And this is where I'm hopeful and where we are seeing some positive movements is through AI. I had mentioned ambient AI. I've spoken with some of my physician friends that do use that, and they have some very positive stories to tell around kind of not having to spend hours in the evening doing all of this busy work and getting that time back.
That is so interesting. And so you really feel like AI could help support returning the joy back to this practice.
Yeah, and I think it's not just for physicians, nurses as well. We have a huge nursing shortage. And then there's a tremendous amount of ancillary staff and administrative staff that kind of support the healthcare system. I think getting rid of some of this stuff that drives you bonkers that you have to do and that repetitive stuff, and so that you really are able to see that what you do makes a difference. I think that's people really enjoy. That's why people want to come to work and not kind of be like, oh, great, the alarm went off and now I got to come in kind of mentality.
So inspiring. So if you could Thinking back on your life, if you could give yourself a piece of advice, career advice or life advice, like just looking back and you're looking at your younger self, what would you tell her about the future? And what would you encourage her to pursue or consider doing differently or think about?
Yeah. I think it's interesting because it's so different, the space now. Like when I was younger and trying to figure out what I wanted to do with my life, you'd physically have to go to the library. Like there wasn't an internet, there wasn't social media, there weren't really podcasts. I didn't really know what I could do, I think was part of it. I knew, I'd mentioned earlier, I loved science and math and wanted to do something around that. I think I fit well in that innovation space. I love to learn and try new things. I think it would have been interesting. Right in front of me, I was able to see up on like a podcast like HITea and hear what others are doing. That might have been interesting in how my career path I might have gotten to where I am today faster. I also think something I probably would have told myself is I don't think I believed in myself as much as I should have. Maybe just a little bit more confidence of like step away from what you're doing a little bit faster and move on to the next thing. I was pretty stubborn, so I think that to my advantage. And then I decide like, okay, I got to try something new. And what is that next new thing to challenge myself?
I love that. Believe in yourself, guys. Believe in yourself and you can make your future happen for you. So to finish this conversation off, where can our listeners find you online?
I'd love for you to connect with me on LinkedIn. I think that's probably the best way to get in touch with me. Please also would love to have you view the upcoming podcast on AI Amplified. You can also probably run into me at some of the conferences out there as well and would love to chat in person.
Terrific. Now, before I forget, did you happen to bring tea with you today?
I did.
Tell me about your mug.
I actually have a story about it. So this tea cup and saucer comes from a 12-piece tea set. So not only cups and saucers, but serving dishes and little plates. It was a very pretty design. It's
so dainty and beautiful.
It is
floral.
In China with little pink flowers, gray leaves with some gold on it. So I was actually born in Scotland, just outside of St. Andrews. My mom, born and raised there. I have a ton of family in Scotland and England. And so we had afternoon tea almost every day. I mean, my grandma on trips, we would go out from her way to make sure we stopped and had a proper afternoon tea. But this tea set, my mom passed down to me. She was given the tea set by my great Aunt Edith and Uncle Willie. So definitely has some meaning there. And I was telling my mom that I was going to be on this podcast and she loved the name HITea. And she sent me a text just before we recorded this. And I love it. It says, "Good luck with HITea. Remember, no pinkies in the air, and afternoon tea is not high tea, which is a solid meal. Enjoy your cuppa."
I love that. Mother supporting their daughters. It never ends, does it?
No, that is true.
Well, thank you so much for joining us today. It was awesome learning from you.
Oh, thank you so much. I really enjoy your podcast and was so excited when you reached out to be a guest.
Oh, I love it. I love it. And thanks to you folks for joining us too. Check out the HITea with Grace podcast for more interviews with great guests like Dr. Bassett today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.